Good morning, good afternoon, and good evening, everyone. It's a pleasure to be here today and to be part of the FAST Virtual Family Science Summit. My name is Brenda Vincenzi. I am the medical director for the Angelman Syndrome program at Roche, based in Basel, Switzerland. And today we spend around 20 minutes together. I'll give you a very brief introduction to Roche and Genentech, to the Angelman Syndrome program, in particular the history and progresses since FAST 2019, the Freesia's observational study, non-drug study. We'll introduce the UB3A LNA molecule and Tangero, our phase 1 drug study. And then we will spend a few minutes to better understand what clinical trials are and why we need to administer treatment through lumbar puncture. So Roche and Genentech are one company. Our mission is to transform the lives of people with serious diseases and their families. Together we have 38 FDA-approved medicines, 22 FDA breakthrough designations, and we've been in the space, in the Angelman syndrome space, for the past 5 years in partnership with many organizations and researchers. We have a long-standing commitment in rare disease, as you can see from the list of approved disease medication on the left side of this slide. We are currently focusing on four pillars in neuroscience, one of which is represented by the neurodevelopmental disorders, which includes Angelman syndrome. So, as mentioned, we've been in the Angelman syndrome space for the past 5 years. We started back in 2015 by listening and learning from the Angelman syndrome community, attending the main conferences. In 2017, in collaboration with ABOM, Angelman Biomarker Outcomes Alliance, we developed the disease concept model in Angelman syndrome. And I'm pleased to say that this work was recently published in the Child Psychiatry and Human Development Journal. In 2018-2019, we started the co-creation of Freesias with families and the scientific community, and in partnership with our colleagues, Ionis and Biogen. So recruitment for Freesia started in September last year, and we also started to prepare for Tangelo, our phase 1 drug study. The first participant in Tangelo was enrolled in the summer 2020 in August, and in September this year we also completed recruitment for Freesias. So as we all know, Angelman syndrome still represents a high unmet medical need, as there is no therapy for such debilitating disorder. Angelman syndrome not only affects the life of individual with the disease, but the whole family. And with this in mind, in order to bring a meaningful treatment to families, we have focused on a potentially disease-modifying treatment that can improve all core symptoms of Angelman syndrome. And this is how we identified our lead compound that you see represented here on the right side of the slide. So we started in the lab from cells from individuals with Angelman syndrome. We developed these cells into neurons, and as expected, these neurons did not express UB3A protein. So we identified compounds that were able to knock down the long RNA or antisense sequence that is responsible for silencing the paternal allele of the UB3A gene. So in the lab, we tested more than 2,300 LNAs, and we chose the most potent and safe to bring forward to the clinic. What we are able to show, both in vitro, meaning in cells, and in vivo, meaning in animals, in this case they are non-diseased animals, we are able to show an increase of the UB3A protein. And as you can see here, if you look at the blue line, you see that the UB3A protein with one administration of the drug at this point increases. I would like to point out that there are no human data so far, and that's the reason why we are running our drug study, Tangelo. So We look at our UB3A LNA as a treatment with the disease modifying potential. And what I'm going to describe here is the mechanism of action. So, as we know, everyone has two copies of the UB3A gene, one copy from the mother and one copy from the father. Both gene copies are active in most parts of the body, but in the brain, so in neurons, only the mother's copy is active. The father's gene copy is intact, but is silenced by this long antisense, a long RNA called the UB3A antisense. So in Angelman syndrome, a genetic change on the mother's gene copy leads to no production of UB3A protein in the brain. And this is our compound. So our LNA targets the UB3A antisense, this long RNA, so that the gene copy from the father can be activated and produce UB3A protein. It basically removes the brake and allows the paternal allele to start producing the missing protein. And here is where we are today. This is very exciting time as we have started after all the work in the lab. We can start the clinical development phase with our Roche phase 1 study Tangero. And this is exactly where we are today. So Freesia's, as I said, Freesia's an endpoint enabling study in Angelman syndrome. Study sponsors Roche and Genentech and is co-founded with Biogen and Ionis. So Freesia is a non-drug, is an observational endpoint enabling study with a decentralized design, as you can see here. You have 2 clinic visits, a baseline and a 12 months, and then some at-home assessments. The primary objectives are the feasibility and the value of novel endpoints and biomarkers to inform clinical trial design. The goal was to enroll 40 individuals with Angelman syndrome age 1 to 12, 10 individuals with Angelman syndrome age 18 plus, and 20 controls for comparison. It's a US only study, and I'm really pleased to say that we are fully enrolled. So thank you very much to all the families and the sites. Here a little overview of some demographic data from Freesia's participants. Here you see the number of enrolled participants. In green you see the total number of enrolled participants up to 75. And in orange, you see per month the number of enrolled participants. You see there is a peak, for example, here around December, and then 8 and 9, again around February. And then because of COVID, we know that recruitment slowed down. We had to put the study on hold. But then I'm really glad that we were able to complete enrollment. In terms of gender, you can see that 54.7% are male and 45.43 female. And here is the participant ages. So as per protocol, this mirrors the protocol. So we needed 10 participant age 18 plus with an individual with Angelman syndrome. You see there in orange, and the majority are individuals age 1 to 12, and these in gray are the controls. And here you see the participants per age bucket. In terms of genotypes, you can see here all the genotypes listed, and as expected, the majority of individuals with Angelman syndrome presented with a class 2 or class 1 deletion. So a couple of things to be aware of. So Freesia's, as I said, is a non-drug study and is in collaboration with Roche, Ionis, and Biogen. These are separate companies working on drug studies for Angelman syndrome. So Roche, we are working independently. We are working on our own Roche drug study called Tangero. Ionis and Biogen are working together, so on their Ionis Biogen's drug study. Eligibility for any current and future drug studies will be based on specific criteria. Participation in Freesia's does not guarantee automatic eligibility for any current and future drug studies sponsored by Roche or Ionis Biogen. So it's true, Freesia is fully enrolled but is not completed yet. So the at-home EEG and the clinic visit too, these two assessments are important, say, as the baseline. So we like to continue to collect clinical scales, e-diaries, and EEG data because this is extremely important to inform the community and future trials design. So because of COVID, we have put in place more flexible solutions in order to safely perform clinic visit too. For example, most of the scales can now be performed remotely and to perform the at-home EEG. So whenever necessary, our vendor technician can be tested before going to the family's home, tested for COVID to perform the EEG. And once again, a big thank you. Thank you to everyone involved, all families participating in Freesias, all trial site teams and study coordinators, academic collaborators, and study investigators. And here you see Tangero. So as I mentioned, Tangero is our phase 1 drug study. It's an open label, meaning that all participants with Angelman syndrome will receive the drug. It's a multi-center study, different centers in the US, Canada, and Europe to investigate the safety, tolerability, and what we call pharmacokinetics and pharmacodynamics of UB3A-LNA, meaning that we want to understand what the drug does to the body and what the body does to the drug in participants with Angelman syndrome. So we will enroll in Tangero up to 66 participants with Angelman syndrome, both males and females, age 1 to 12. The genotypes included are mutations and deletions. The locations, we have 6 countries and 17 sites, and you can check the details on clinicaltrial.gov. The study duration, as I mentioned, we started enrollment in August 2020. We aim to complete the study at the end of 2022 for a total study duration of 58 weeks. Here, some more details around the study design of Tangero. As mentioned, it's an open label. All participants receive the study medication. Multi-center, different centers, adaptive, multiple ascending, intra-participant dose escalation. So after an initial screening period that can go up to 6 weeks, participants can be enrolled in the trial. And they will start the treatment period that covers 8 weeks. So they will receive the first dose, after 4 weeks the second dose, and after 4 more weeks the third dose, with an intra-participant dose escalation through intrathecal administration or lumbar puncture. After the treatment period, participant will enter the follow-up period up to 44 weeks. Objectives, as mentioned, are safety, tolerability, pharmacokinetics, exploratory pharmacodynamics, and efficacy. And here some information about clinical trials in general. So clinical trials are medical research studies that involve people. New drugs are first studied in a laboratory, like I mentioned at the beginning of the talk, and those that look promising go on to be carefully studied in people through clinical trials. The aim of a clinical trial is to test new drugs to see how well they work in helping people feel better or in helping a disease to improve or stop getting worse. Clinical trials are also test whether new drugs are safe and if they have any side effects. This information is vital to help doctors understand which treatments are the most suitable for their patients. These are some important terms in clinical trials. So before participants can enroll in a clinical trial, they have to give their informed consent. Risks, benefits, and time alternatives are explained to the participant or the caregiver before they sign the informed consent. So please ask all the questions you might have to the principal investigator at your site before you sign the informed consent. In Tangero, in our drug study, the informed consent is signed by the caregiver or the legal representative. In Tangero, we also have in place a very informative and very easy to understand video on the informed consent. Only after the informed consent has been signed can participants be recruited, screened, and if they are eligible, enroll or take part in the study. Inclusion criteria are the factors that allow someone to take part in a clinical trial, while exclusion criteria are the factors that prevent someone from participating in the trial. People who are interested in participating in a trial, we go through a screening process to check if they meet all of the inclusion and none of the exclusion criteria for the trial. If after screening they meet all of the inclusion and none of the exclusion criteria for the trial, they will be eligible to join the study. Enrolling is the process of entering a person into a clinical trial. Once a person has been enrolled, the participant will then follow the clinical trial protocol. A person can only be enrolled if there is an open slot for them in that particular study. Of note, a person can leave the study at any time during the trial. And here's some information about the cerebral spinal fluid that we call CSF, the blood-brain barrier, and the lumbar puncture. So the cerebral spinal fluid or CSF is a clear body fluid that is produced in the brain and it surrounds the brain and the spinal cord. Their functions are to protect the brain, it regulates the chemical environment of the nervous system, and provides the brain with nourishment and helps with waste product removal. Analysis of the CSF is routinely performed and is a useful technique for diagnosis and prognostication of neurological diseases. Here you see what we call the blood-brain barrier, and this is to better understand why an intrathecal administration is needed. So the CSF is separated from the blood by the blood-brain barrier. So the blood-brain barrier separates the CSF from peripheral tissues, for example, the blood. Here you see a blood vessel outside the brain with some pores where molecules can easily pass through. And here in the blood vessel in the brain, you see we have tight junctions. So this is part of the blood-brain barrier, and the transfer of drugs across the blood-brain barrier into the CSF is often prevented by factors such as the size of the drug or the charge, or both. So the intrathecal administration allows a drug to be introduced directly into the CSF, so the drug doesn't have to go through the blood-brain barrier. What's a lumbar puncture? So a lumbar puncture is a frequently performed procedure for diagnosis, anesthesia, and in medical emergency. Our drug is given through a needle inserted in one of the spaces between the bones in the lower back. The drug is injected into the CSF that is around the spinal cord and the brain. And this is also called intrathecal injection. So, what to expect if you decide to enroll your child into our trial? So, to perform the lumbar puncture, the participant needs to stay still. So the doctor might administer some drowsing, sedation, or sleeping medication, anesthesia. The skin is carefully cleaned and a little injection of numbing medication is given. The needle is inserted as some drops of CSF are collected to be analyzed. The drug is then injected into the CSF and will travel up to the brain. The needle is then removed and the part and the skin is then covered with a plaster. So I hope that this information was helpful, and I just want to thank you very much for your attention.